The patient is positioned supine with the right knee maintained in 20 degrees of flexion and valgus alignment. The lateral portal is the observation portal. A shaver is used to debride the synovial tissue. The posterior root is examined with a probe to confirm a complete tear with full detachment from the attachment site. A radiofrequency is used to debride cartilage, followed by bone bed freshening with a bone curette. The lateral portal is the observation portal. A 45 degrees tibial targeting device is positioned at the posterior root attachment zone. Initially, a 2.0 mm Kushner wire is inserted to create a narrow bone tunnel. Subsequently, under the guidance of the Kushner wire, a 4.5 mm drill bit is used to create a broad bone tunnel, with a length difference of 1 to 1.5 centimeters compared to the narrow bone tunnel. A spinal needle loaded with a PDS suture is passed through the tunnel into the joint, and the needle is then removed. The PDS suture's distal end is knotted to secure threads of the 3.0 mm anchor. The lateral portal is the observation portal, and the anchor is inserted in a reverse direction by tensioning the PDS suture into the bone tunnel and fixed at the junction of the broad and narrow bone tunnels. The anchor sutures are pulled multiple times to test the fixation strength in the bone tunnel. The lateral portal is the observation portal. The anchor sutures are placed via the cannula using a scorpion suture passer, performing a horizontal mattress suture at 5 mm distal to the tear site and a simple suture at 7 mm, collectively constituting a modified Mason-Allen suture configuration. Concurrently, a PDS suture is passed through the posterior root and delivered via the cannula in preparatory positioning to facilitate the fibrin clot delivery into the joint cavity. Using a ground glass rod, stir the blood in the glass syringe clockwise for approximately 15 minutes to prepare the fibrin clot. The fibrin clot is circumferentially secured with an absorbable suture, with one end anchored by knotting to the PDS suture. The lateral portal is the observation portal. Tensioning the PDS suture delivers the fibrin clot through the cannula into the joint cavity. With the assistance of traction through the PDS suture and a probe, the fibrin clot is introduced into the posterior root attachment area. The anchor sutures are secured by knotting to achieve rigid fixation of the posterior root and the fibrin clot at the attachment zone. Post-operative probing of the posterior root demonstrates excellent stability. Approximately 4 milliliters of platelet-rich plasma is prepared using a medical centrifuge and loaded into a sterile syringe. The lateral portal is the observation portal. The platelet-rich plasma loaded into the syringe is connected to a spinal needle, and under arthroscopic guidance, the fibrin clot is slowly injected.